A 10-month-old infant boy is brought to the physician with poor feeding and vomiting. He had been diagnosed with a viral upper respiratory infection 2 days ago, but the child had been healthy and feeding normally. The child is currently unresponsive and lethargic. His temperature is 36.7 degrees Celsius, 98.0 degrees Fahrenheit, pulse is 110 beats per minute, and blood pressure is 96/40. The physician is able to palpate the liver 4 centimeters below the right costal margin. An echocardiogram is unremarkable. Laboratory tests show a serum glucose of 40 milligrams per deciliter. Which of the following is the most likely cause of this patient's condition? Choice A, glucose 6 phosphatase deficiency. Choice B, acid maltase deficiency. Choice C, adipose triglyceride lipase deficiency. Choice D, carnitine deficiency. Choice E, medium chain fatty acid oxidation error. Or choice F, very long chain fatty acid oxidation error. I'll wait 5 seconds and answer the question. So when you see this really bad hypoglycemia in a child like this, you instantly start having red flags of certain genetic diseases. There are a couple things that are noteworthy in this question. First is that there's no presence of ketones. I didn't specifically say no ketones, but if I don't say that there are ketones, I think it's probably safe to assume that there aren't any. That alone already tells you it's more likely a fatty acid error rather than one with glycogenolysis or whatever. There is also notably nothing wrong on echocardiogram, which tells you that there probably isn't cardiomegaly, which helps you rule certain things out. There is hepatomegaly, but you tend to see this in a lot of different conditions like this. But for the most part, you kind of have to eliminate your way to get there for this question. So this patient has MCAD, which is medium chain acyl-CoA dehydrogenase deficiency, which is why choice E is the correct answer. This usually shows up between ages 3 months to 2 years or so. And it happens right after a stressor of some kind, which in this case is a viral illness. That's a pretty common way to like presenting it to you. And the reason it happens after a stressor is because normally you don't need to break down your adipose tissue, right? Normally you can just use whatever you're eating. So you don't break things down until you have some stressor, like you're starving or you have some kind of illness. So that really helps us to eliminate a lot of these wrong answer choices here. So let's just get right into that. Choice A, glucose 6 phosphatase deficiency. This is talking about von Geroch's disease, which is glycogen storage disease type 1. Which is a lack of glucose 6 phosphatase, as I mentioned here. So because you're missing the final step needed to perform gluconeogenesis, you basically cannot form glucose from your glycogen stores. Basically, no matter what you do, right? You can't do the final step. So this will usually be really, really sick child, and they will be much younger than 10 months. Usually within a couple months of being born, sometimes even at birth. Some rare instances you do see von Geroch's manifesting at birth. And you're going to have hypoglycemia, of course, hyperketotic hypoglycemia. You're going to have lactic acidosis because obviously your body is going to be going through forming lactose if I can't get glucose anywhere else. And it's usually pretty severe. You're going to have like seizures. You might have abnormal faces and gout, hypertriglyceridemia. Just in general, it'll probably look even worse than this. Choice B, acid maltase deficiency. This is referring to glycogen storage disease type 2, also known as lysosomal alpha-1,4-glucosidase deficiency, or also known as Pompe disease. All you want to know about Pompe disease is, first you want to know these various different names for it, because USMLE likes to play medical thesaurus as usual, and they like giving different names for it. But the other thing is that you want to know that this is technically both a glycogen storage disease and also a lysosomal storage disease, because it is a deficiency of an enzyme for breaking down glycogen in lysosomes. It causes glycogen buildup, and it is especially bad for the heart. So usually when you see some kind of glycogen storage disease kind of presentation, and then they start talking about cardiomyopathy or cardiomegaly, you can start thinking about Pompe disease. And actually, interestingly enough, hypoglycemia actually isn't typical of Pompe. Choice C, adipose triglyceride lipase deficiency. This is a distractor. It's just some super obscure condition that I threw on here to mess with you guys. This is a condition where you have a hard time breaking down triglycerides in tissues, and then you'll have really bad myopathy and liver dysfunction. Like I said, super rare, probably super low yield, probably don't need to know this. Choice D, carnitine deficiency. Now, of course, you do want to remember that carnitine shuttle is a key part of fatty acid metabolism, and it's mainly important for long-chain fatty acid metabolism. But even so, it can present similar to MCAD, but you can differentiate it from MCAD in that MCAD doesn't really have cardiomyopathy, like I said, and carnitine deficiency tends to have cardiomyopathy. And very similarly, choice F, very long-chain fatty acid oxidation error, VLCADD, is also pretty similar to MCAD, but once again, this also presents with cardiomyopathy. So what you want to take away from this question is that you might want to be aware of the different metabolism errors, hypoglycemia in children. And as far as these sort of fatty acid disorders go, the most common one is MCAD, which is medium chain acyl-CoA dehydrogenase deficiency. Hope you found this video helpful. I'll see you in the next one.